So hello, my name is Philippe Moreau. I'm working at the University Hospital of Nantes in France. And on behalf of my colleagues, I'm very happy to speak about the results of the PERSEUS study, especially the sustained MRD negativity data. In fact, as you know, the PERSEUS is a randomized phase 3 trial that looked at the impact of the addition of daratumumab to the VRd combination in the setting of autologous stem cell transplantation. In the DARA arm of the study, patients received lenalidomide and daratumumab maintenance during at least 2 years. And for those patients with a sustained MRD negativity, daratumumab could be stopped, in fact, and patients continue with lenalidomide alone. In the VRd arm, patients received lenalidomide maintenance. So we looked at patients enrolled into the PERSEUS study with what we are calling a functionally high risk. Functionally high risk means patients that are going to progress within the first 18 months of treatment initiation. And in fact, with DARA-VRd, you see that this rate of functionally high risk patients is only 3%. So very, very few patients, in fact, did progress during the first 18 months of treatment initiation. We looked at the characteristics of those patients with functionally high-risk disease, and in fact, as expected, we have more patients with an ISS3 and more patients with poor cytogenetics. And then you remember that the progression-free survival, already published quite a long time ago now in the New England Journal of Medicine, was highly in favor of DARA-VRd with an exceptional 84% PFS at 4 years, in fact. And we already published that the rate of MRD negativity were much higher at 10 to the minus 5 and 10 to the minus 6 with DARA-VRd versus VRd alone. And the news presented at ASCO and EHA this year was related to the sustained MRD negativity data, sustained at 1 year and sustained MRD negativity at 2 years as well, 10 to the minus 5. And you see this big difference in favor of DARA-VRd. And those patients with a sustained MRD negativity at 1 year and 2 years are patients more with an ISS1 and also more patients with standard risk disease. What was important was to look at the progression-free survival for those patients by sustained MRD negativity 10 to the minus 5 at 1 year and 2 years. And importantly, when patients are reaching sustained MRD negativity during 1 year, the 4-year PFS rates are really high, 95% with daratumumab, but also very high with VRd alone, 94%. So definitely the role is to reach MRD negativity, but also sustain MRD negativity. And importantly, when you are comparing the number of patients reaching sustained MRD negativity at 1 year with DARA versus no DARA, there is a big difference. In fact, 64% of the patients are achieving sustained MRD negativity at 1 year with daratumumab versus 30% only with VRd. And this is also true for patients with sustained MRD negativity at 2 years. And the PFS is really outstanding, 98% or 97% with VRd or DARA-VRd. So definitely very good results as well with the triplet, but the number of patients reaching sustained MRD negativity at 2 years with daratumumab is much higher, in fact, 56% versus 22% only with VRd. So the conclusions are very clear. In fact, functional high risk, only 3% with DARA-VRd, that is very, very low, and sustained MRD negativity, 10 minus 5, sustained 1 year and 2 years is associated with fantastic PFS results. And those results are very, very good when you are using daratumumab during induction, consolidation, and maintenance as well in combination with lenalidomide. And I thank you for your kind attention.